Hi there, I'm Dr. Tanvi Mahant, and as every Tuesday I talk about some homeopathic topic, either remedy or literature, and this video is basically only for purpose of sharing my knowledge, sharing my readings to budding homeopaths. So today we are going to discuss a remedy called Thyroidinum. Now Thyroidinum is a sarcode which is prepared from healthy thyroid gland of sheep. Now Thyroidinum as a remedy I use widely in practice. Now students or young practitioners think that Thyroidinum can only be used for thyroid gland dysfunction or for hypothyroid or hyperthyroid cases, but its action is not limited there. Now as we know, physiologically also thyroid gland and thyroid hormones have wide range of actions, right? It is an endocrine gland which controls a lot of metabolic functions. It controls growth and development, specifically in kids also, or in newborns, your mental development, your physical development. It works in synchrony with your growth hormone and helps in growth of the child. It controls your metabolic rate, it controls your fertility, menstrual health, and a lot of things is controlled by your thyroid hormone. Similarly, even in practice, thyroid or Thyroidinum is used for multiple cases. Now let's talk about few indications or general characteristic indications in which I usually use Thyroidinum as an intercurrent remedy, as an indicated remedy, or as an intercurrent remedy in cases of thyroid problems, either hyperthyroid or hyperthyroidism. So usually Thyroidinum are chilly patients, so people who actually has cold hands, cold clammy hands and feet, people who crave sweets or who are obese. Usually Thyroidinum patients, they have tendency to obesity, or in children, if we consider, children could be emaciated as well, or it is also used in cases where their children have difficulty in gaining weight. There is a lot of malnutrition, diarrhea. There is also a case which is mentioned by Dr. Clark, where he has used Thyroidinum. Initially began with Bacillinum in a child who was not gaining weight, who was lean, thin, emaciated, malnourished, and then he had used Thyroidinum. Also, if patient has family history or any past history of any metabolic disorders like diabetes, etc., has tendency to allergies, respiratory allergies, skin allergies like urticaria in the past, or has a family history of the same. So these are the few general indications in which Thyroidinum can be used. Now, talking about its action, obesity, as I said. So in skin also, obstinate cases of psoriasis. If you have obstinate cases of psoriasis associated with obesity, associated with metabolic disorder, and which are not responding to remedies, you can think of Thyroidinum. Also, there has been cases which is mentioned in our literature, and where Thyroidinum starting with lower potency and then increasing the potency has worked very well. Now, it is an excellent remedy for menstrual irregularities and menstrual problem, even during the menopausal or climacteric period, where there are a lot of symptoms, like example hot flushes, palpitation, anxieties with irregular menses. You can think of Thyroidinum. If the indicated remedy fails, it is almost complementary to lachesis, and if lachesis doesn't give that much relief, you can think of Thyroidinum. I remember a similar case which I have treated in practice. A female during a climacteric period, had all the usual symptoms, plus she had severe menometrorrhagia, severe menometrorrhagia, which was not responding to any remedy, and in her case also I had used Thyroidinum, which had given instant relief. Also, in cases of chronic amenorrhea for months, Dr. S.K. Ghosh has written his writing to use it in lower potency, 3x potency for scanty menses or amenorrhea, and in cases of menorrhagia or menometrorrhagia, usually use it in higher potency like 30 and so on. So also it is a good remedy for children who has retarded growth and development, okay, delayed in milestones, arrested growth. We can think of using Thyroidinum as a remedy. So as I said, it has multiple uses. Now there's a book by Dr. S.K. Ghosh where he has mentioned a lot of cases, also in childhood cases, for infantile convulsions, for newborn jaundice. Alright, he has mentioned use of Thyroidinum, where, as I mentioned, few general indications of Thyroidinum persist or a family history points to this remedy. Obviously, I use these cases in thyroid cases, also in cases of goiter, where the indications I mentioned are present. Also, if there is onset of hyper or hypothyroidism after acute disease, right, we can think of using Thyroidinum. In repertory, in acromegaly, Thyroidinum is the only remedy which is mentioned, right? So again, you see that Thyroidinum is very closely linked with growth hormone, and where the growth hormone functioning is also somewhere wrong, okay, we can also think of using this remedy, Thyroidinum. I think mostly I've covered a few indications and topics also. It has also very good actions on heart, angina pectoris, because thyroid gland itself also controls a lot of cardiac function. So in general, this sarcode, okay, is used very commonly nowadays in practice because we get a lot of complex metabolic disorders, right? A lot of obese patient associated with diabetes, allergies. So I commonly use this remedy as an indicated remedy or as an intercurrent. Also, females who have history of recurrent abortions in the past, right, or premature deliveries, you can think of this remedy as Thyroidinum. And if you have in support history of hypothyroid, history of goiter, it also, okay, makes the prescription more accurate. So if you have used Thyroidinum in any case, do write in the comment section. I use it for multiple problems, as I said, in my practice. I might share a few cases in my next video. I hope this video was helpful. Thank you.